Hey everybody, welcome to the introduction to first aid and health. Let's get started. So what is first aid? First aid is medical care provided to someone who is in need of immediate assistance due to illness or injury. A first aid kit, that's one of the key things to performing a successful first aid, and something that is properly stocked. And always make sure you're checking to make sure things are not expired and up to date. Once you purchase a first aid kit, you should familiarize yourself with what is inside. Make sure your kit materials get replaced and replenished as needed. So what is in a first aid kit? So this picture kind of gives you a general idea on some items that can be found in a first aid kit. Starting at the top, gauze rolls and packs, bandages, adhesive tape, first aid manual, gloves, tweezers, scissors, a triangular bandage, safety pins, thermometer, antiseptic wipes, emergency blanket, elastic bandages, and instant cold packs. Bleeding, cuts, and scrapes. Priority number 1 is to stop the bleeding. Maintain composure, no need to panic. Most cases, bleeding can stop by applying pressure to the area. Apply clean bandage to the wound. If bleeding persists, apply pressure for 15 to 30 minutes or elevate the area. If it is a large wound or bleeding persists, contact 911 for assistance. Nosebleed care. Sit upright and lean forward. By remaining upright, you reduce blood pressure in the veins of your nose. This discourages further bleeding. Sitting forward will help you avoid swallowing blood, which can irritate your stomach. Gently blow your nose. Do not blow hard. Blow your nose to clear your nose of blood clots. Pinch your nose. Use the thumb and index finger to pinch your nose shut. Breathe through your mouth. Continue to pinch for 10 to 15 minutes. Pinching sends pressure to the bleeding point on septum and often stops the flow of blood. If the bleeding continues after 10 to 15 minutes, repeat holding pressure for another 10 to 15 minutes. Avoid peeking at your nose. If the bleeding still continues, seek emergency care. To prevent rebleeding, don't pick or blow your nose, and don't bend down for several hours. Keep your head high, higher than the level of your heart. You can also gently apply some pressure, and you can also apply petroleum jelly to the inside of your nose. If rebleeding occurs, go through these steps again. Call your doctor if the bleeding continues. When to seek emergency care? The bleeding lasts for more than 30 minutes. You feel faint or lightheaded. The nosebleed follows an accident, a fall, or an injury to your head, including a punch to the nose that may have broken your nose. A non-bleeding wound. Wounds that do not cause bleeding should be treated with as much attention as wounds that do cause bleeding. Lists of injuries where you should suspect injury: internal injury, car crashes, shock signs after the injury, injury via collision, generally from sports, injury to abdominal or pain in the abdomen, injury to the chest or pain in the chest, blood discharge after the injury, firearm or knife wound. Non-bleeding wounds continued. When faced with the victim that you suspect has non-bleeding injuries, you must follow these steps. Contact emergency services. Put the victim in the horizontal position on his back. Make sure the victim does not move. Check for signs of shock. If the victim does not respond, start CPR. First-degree burns. The least serious burns are those in which only the outer layer of the skin is burned. The skin is usually red with swelling and is painful. The skin is dry without blisters. So an example of this type of burn would be a sunburn. Second-degree burns, more serious and involve the skin layers beneath the top layer. Burns produce blisters, severe pain, and redness. Some examples of a second-degree burn are severe sunburns, accidents with ovens or stoves, exposure to fire, and contact with boiling water. Third-degree burns, the most severe burn. The burns are painless due to nerve damage and involve all layers of the skin. Burned area may be charred brown, leathery, or appear dry and white. This type of burn will require a call for emergency medical assistance. Some examples of a third-degree burn is exposure to scalding liquid, skin that comes in contact with hot objects for an extended period of time, flames from a fire, an electrical source, and a chemical source. Things to remember: do not apply butter or ointments to the burn to ensure proper healing. Don't break blisters to prevent infections. Don't use ice to prevent destruction to the skin. Don't immerse large, severe burns to cold water to prevent shock. Until an emergency unit arrives, make sure that the victim is no longer in contact with the burning material or exposed to smoke or heat. Don't immerse large, severe burns in cold water to prevent shock. Check for signs of circulation, and if there is no breathing or other sign of circulation, proceed with CPR. If possible, raise the burned body part above heart level. Use a cool, moist bandage to cover the burned area. Fractures. Fracture is a broken bone. Two types: closed, also called simple fracture, those in which the skin is intact. Open, also called compound fracture, involve wounds with mild or severe bleeding. And on the right side of the page are pictures of the different types of fractures. Sprain or strains. A sprain is an injury which occurs as a result of stretching or tearing of ligaments. A strain is an injury which occurs as a result of stretching or tearing of muscles. Again, there are some examples here on the page of what both a strain and a sprain look like. First aid for fractures, sprains, and strains. If someone is there, send a call for help. If the person is unresponsive, isn't breathing, or isn't moving, proceed with CPR. If bleeding, stop the bleeding by applying pressure to the wound with a sterile bandage or clean cloth. Apply a bag of ice to the injury area for up to 20 minutes with the towel between the skin and the ice. Raising the injury part does not cause more pain to the victim. Attempt to raise it. If the person feels faint or is breathing in short, rapid breaths, lay the person down with the head slightly lower than the trunk, and if possible, elevate the legs. Breathing problems and choking. Our body relies on oxygen to work properly. Without oxygen, the survival time could vary from 1 to 3 minutes. General reasons for developing mild or severe air passage blockage include asthma. Swelling of the lining of the airway can be related to an allergic reaction, such as being allergic to eggs, peanuts, stings by insects or bees, food or small objects like medication pills going down or in the air passage instead of the stomach, infections, and injuries to vital organs, such as the head, stomach, and more. Choking. This may occur when food or small objects like medication pills go down into the air passage instead of the stomach. Older than 1 year of age, abdominal thrusts, Heimlich maneuver. Thrusts push the air out of the lungs, causing person to cough, which will help remove the foreign object blocking the airway. Asthma attack. He or she might experience mild or severe breathing problems, can cause chest pain, coughing, and wheezing. Airways are inflamed, narrow, and swelling and producing extra mucus. An allergic reaction. Common treatment includes an epinephrine, so utilizing an EpiPen. This can be injected through cloth and onto the skin. Common allergic reactions come from eggs, peanuts, insects, and bee stings. First aid general guidelines. Make sure the scene is safe for victim and for yourself. If the victim is responsive, introduce yourself and offer help. If the victim agrees, proceed with first aid and administration. If the victim refuses, call 911 and wait for the arrival with the victim. If the person is unresponsive, assume that your help is needed and proceed with first aid, CPR, if certified. Tips on calling 911. Dial 911. Let the operator know your city and exact location immediately. Describe your surroundings in detail. Specify your emergency. Keep calm and speak loud and clear. Head, neck, and spine injury. You should suspect a head, neck, or spine injury in case of the following accidents: a car or motorcycle accident, fall from heights, injury to the head, fighting, sporting events, such as a concussion, and then electrocution. Head, neck, or spine injury continued. You should suspect a head, neck, or spine injury if the symptoms below follow the accident: lack of responsiveness or moaning, vision problems or confusion, trouble walking or moving, seizures, vomiting, or headaches. Steps for administering first aid. As always, make sure the scene is safe for you and the victims. Phone or ask someone to phone 911. Hold the neck and head so it does not move, twist, or bend. Turn the victim only if the victim is in danger, if you need to check if the victim is breathing, or if the victim is vomiting. If the victim does not respond, begin CPR.